Hi, my name is Tessa Hulstein and I will be your assistant today. And today we're just going to be doing a caries risk assessment and just talking about how to correctly brush your teeth while you're here at our office. So first I'd like to start with just some general instructions that we like to give our patients on how to properly brush and floss our teeth. So first off, when brushing our teeth, we always want to use a soft bristle toothbrush and we want to use an anti-cavity fluoride toothpaste. And all you're going to need is a pea-sized amount of that. Also, we'd like to at least brush our teeth for at least 2 minutes twice a day. And when brushing our teeth, we should hold the toothbrush at a 45-degree angle at the gum line and brush in a circular motion or a vibrating motion. And when brushing, make sure to, when you're going between each area, hold the brush in one area for 10 seconds and then move to the next area. And always have a pattern when brushing your teeth because it helps us not forget any spots, so then we don't miss any spots when brushing our teeth. Also, don't forget to brush your tongue because that's also very important to help get rid of the bacteria. And don't brush back and forth really hard because it does cause gum recession and it's very abrasive to the tooth structure. So when flossing, we like to floss at least once a day, and all you'll need is an arm's length of floss, and then you'll just take your arm's length of floss and wrap it around your middle fingers and then hold it between your pointer finger and your thumb and seesaw it in between your teeth, and then you'll make a C shape around the front side of your tooth and then the back side of your tooth. And be sure not to forget the behind your last molar when flossing. Flossing is very important and it helps prevent periodontal disease because it gets that plaque out between your teeth that our toothbrush can't reach. So I'd just like to talk to you just a little bit today about how you brush your teeth. So when you're brushing your teeth, if you could show to me how you brush your teeth. So in a back and forth motion then is what you normally use. And circular in the front. Okay, so the circular in the front, that's great. We'd like to keep that. But in the back, we want to hold our toothbrush at a 45-degree angle to the gum line and then try to do circular motions in the back like this. It'll just help. It's better for your teeth. It'll keep the gum recession down, which would expose your roots, which makes you more probable to have a cavity up there. So that's just how we like to brush, and then we also make sure we're doing 10 seconds in one area and then moving on to the 10 seconds in the next area. And a pattern also, because that will help a lot. So when flossing, do you floss pretty regularly, or is that not?
3 times a week.
3 times a week? Okay. If we could get that to once a day, that would be very ideal. So with our floss, I just have my arm's length of floss here, and then you'll just wrap it around your middle finger, and then your other, and then your other middle finger, and then just hold it between your pointer finger and your thumb. Seesaw it in between those teeth, you form your C around the front and back, and then we make sure to get our last molars. So, it sounds like you have pretty good brushing habits and flossing habits, so what about eating habits now? Are those pretty good, or do we eat a lot of junk food, drink a lot of pop?
No, I don't drink pop. I don't drink juices.
Okay.
I drink a lot of water.
Water, that's good. We like to hear that especially. So just taking a quick peek at your caries risk assessment, it says you're getting, looks like you're eating fluoride through your toothpaste and then probably through your water also, which is great. It says that you never drink sugary drinks or have sugary foods, so that's great. We really like to hear that. I mean, the occasional cookie, we all like the occasional cookie. Just be sure to brush your teeth afterwards. It also looks like caries are not very high in your family, so that's good. Looks like you haven't had a cavity for the last 2 years, so that's awesome. Visible plaque is nothing. You can't see any of your root surfaces. You don't have orthodontic appliances, so that's not something we have to talk about with flossing then. It looks like you're at home, your dental care. I mean, we're obviously your dental home, and you know, it looks like you come in every 6 months for checkups, so that's great. So it looks like sounds like you're taking very good care of your teeth. I don't see anything here that throws a huge red flag up, so that's awesome. Just my biggest suggestion would be try to use circular motion when brushing in the back. That will definitely help with the gum recession. It'll be more beneficial to you in the long run. So, soft bristle toothbrush twice a day. Make sure we try to floss once a day. And yes, if you have any questions, please give our office a call. And thank you for coming in today. Have a nice day.